Well, hello, everybody. Welcome to the SpeechLink podcast today. We are talking about the difficult to test, dynamic methods to identify language abilities and therapy needs, which sounds good to me. And before we begin, let's cover some of the disclosures. Regarding financial disclosures, in addition to receiving an honorarium for this podcast, Stephanie, our guest, receives royalties from Routledge Publishers for her well-received book. And personally, I too receive an honorarium for this podcast, and I'm a regular presenter, seminar presenter for speechtherapypd.com, and I own Speech Dynamics Inc. Neither of us have non-financial disclosures. Okay, so happy that you're here for our SpeechLink podcast, sponsored, of course, by speechtherapypd.com. And I'm Char Boshart, your speech language pathologist host. Stephanie LoPresti, MS, CCC-SLP, TSSLD, is a speech language pathologist with over a decade of diverse experience across medical, academic, and private settings. She served clients from infancy through geriatrics, and her expertise extends across speech and language disorders, feeding and swallowing, cognitive impairments, and augmentative communication. Stephanie has a special commitment to patient-centered care and is an experienced clinical fellowship and speech language pathologist assistant supervisor. Most notably, Stephanie is the author of the comprehensive and evidence-based guide, The Speech and Language Protocol, an assessment tool for early years. It is a resource that enhances assessment as well as service delivery. She also presents academic lectures and professional development seminars. And I also kind of want to add, and she's probably thinking, where's she going with this? She and her brand new husband, as of a week ago, live in New Jersey. Congratulations to both of you.
Thank you so much.
Well, you're very welcome. And welcome to the Speech Link, Stephanie.
Thank you so much for having me, Shar. It means the world.
Oh, well, good. I'm very excited that you're here and anxious to learn from you. Um, you obviously have a breadth of experience and with a variety of ages and populations. And I was just kind of wondering, what prompted you? How did you narrow down to focusing on assessment with young children?
I'm sure that's probably a question I get most from a lot of people. So, despite my experience with like schools, clinics, home-based services, over time, I found myself consistently drawn to the early years. There's really something incredibly impactful about being part of that initial window when a child is just beginning to build their communication skills. It's really when the brain is most malleable and responsive to intervention. As you can see, I've worked in early intervention for years, so this is really where it kind of sparked. I also realized that I deeply enjoy the detective work involved in assessments. So from babyhood on up, when young children, especially those that are pre-verbal or minimally verbal, assessments require like a blend of clinical expertise, your work, developmental knowledge and creativity. I found myself not just evaluating skills, but interpreting behaviors, right? So it's more dynamic, analyzing their play and collaborating closely with families to piece together a full picture of a child's strengths and needs, which I think is important. And so, while I value the diversity of my background, it became clear that my passion and real skill set aligned most with early identification and assessment. It's really where I feel I can make the most effective difference and where my clinical instincts and observational skills were most utilized. As an aside, in my CF year, I actually worked for Boulder Head Start in Colorado, and they had me conduct some screeners with children. So I formulated my own screeners because I just felt like it was easier to do so. So
Mhm.
I actually still have those to this day. They're in my parents' garage, but I think it started from my CF year way back in the day. So
Okay.
yeah.
Okay. Yeah. Sort of planted the seed and now it grows. And you know what? I don't know if anybody else has said this, and I have a feeling that we probably all have, but you don't hear it very often. We need some really good assessments. And I know because I've worked a lot in the schools, and basically the assessments at that point in time. Now, I don't know if the assessments have changed a whole lot. I don't think that they have. Um, just sort of give me an indication whether the child qualifies for speech and language, or one or both, or not, but not a great jumping off place as far as really what they need. I mean, I see some ups and downs and maybe some strengths and weaknesses, but I think assessment is just so needed in our field, and I'm really anxious to hear what you have to say. And that makes total sense what you were saying there about assessment and just all what we need to do assessments. And we can't just rely on, the printed,
Standardized scores.
protocols and, that kind of thing. Yeah. And especially when you're working with pre-verbal, or low verbal kids. So I know that you've talked about and mentioned to me about the zone of proximal development. Now, I kind of learned about this when I was, looking up reading information and, preparing for, language therapy and language courses and that kind of thing. But, tell me, and my brain has probably forgotten most of that, but, tell me about the concept of the zone of proximal development and how that influences what you do in your dynamic assessment.
Of course. So, just as a background, my undergraduate was in psychology.
Uh,
So, the zone of proximal development comes from Vygotsky. And so, basically, what the zone of proximal development represents is the range between what a child can do independently and what they can achieve with guidance. Just the smallest amount of guidance, right? Um,
okay.
it includes so if we're utilizing the zone of proximal development, it allows us to identify this optimal level of challenge for a child. So it really promotes effective learning and development. So originally, when Lev Vygotsky was talking about this, he spoke about the more knowledgeable other. I know a lot of my SLPs here probably have psychology background or knowledge. And basically, what is that? It's someone who knows more than the child does. So it can be a parent, it could be a caregiver, it can be an older sibling, or in our case, it's the speech pathologist. We are speech pathologists, we're the more knowledgeable other. So the idea is if you're always working in that zone of proximal development, which is generally one step above where they've ceilinged out, right? So let's say they're only saying one word utterances, they're labeling. The zone of proximal development, if you're looking at these stages, is one step above that, right? So let's say we want to scaffold them to two words. So you're working within their range of acquired skills. So the idea is with the least amount of intervention, we're able to get them to that next step and then get to carry over. So that's kind of where my idea of the protocol came in. How can I identify where a child is functioning, not only for evaluation, but continued treatment? So we always talk about taking tally scores when we're in therapy, right? Why do we do that? So that we know where we are and where we're going. And children are, that they're constantly evolving. You can come into one session, whereas I have some children who weren't engaging in joint attention. And then the next session, they come on over, look at me, point to something, and then we have the next stage, right? So the idea is that if you're always working in their zone of proximal development, you're kind of getting them to that next stage. And that's what we're doing as interventionists, right?
Mm-hmm. Okay. Okay, that makes sense. My brain got stuck on one word that you said,
What was that?
guidance.
Mm, yes.
And, is it prompting? I mean, for some kids, is it just looking at them and maybe just, taking your hand and sort of, gesturing over to whatever it is that you were wanting or whatever? Or is it giving them a little prompt of just starting them off with the first sound? Or are you saying the word? Or, I mean, is that kind of what you're looking at? Or, like guidance is a huge area. Like, how do we know?
Yes. And so, I mean, this is where our clinical skills step in, right? So, when we talk about like the least amount of guidance, so for a child that almost has the skill, it could just be a gesture or a point, right? Or do I have to give them a prompt I want? Or am I giving them a binary choice? Which one do you want? Right?
Mm-hmm. Mm-hmm.
So it's really, and that's again, that's kind of where like clinical skills come in. How much can we give and then eventually take away those prompts? Because the goal of intervention and, kind of assessment is to see how the child is doing and how they respond to these different prompts, right? So it's dynamic. It's dynamic
Mm-hmm.
in
Mm-hmm.
nature.
Mm-hmm. Mm-hmm. Yeah. Yeah. That's an art. And I'm going to say that, this type of assessment is probably not something that you just learn, walk in and do, and you're really good at it. That it's something that evolves over time. Is that true? Or, y- how do we learn this? I mean, we read your book.
Yeah, of course.
That's
Yeah.
a start. That's a start, maybe get Vygotsky out there and, pick up on some things that he was saying. But, um, how do we generate that? I'm going to call it an art. It's it's something that you have to be so keyed in to the child and then so aware of what those little things that we do to
Responses are,
guide.
right? Yeah.
Yes, those things that we do or not do. Yeah, to stay within that zone of proximal development, that ZPD.
Yeah.
um yeah.
And so basically, if we're taking off, so just an aside, I work with New York City Department of Education. I'm an independent contractor, which means I assess in the schools. So I love how you had mentioned we have to do the standardized tests, right? The new component, which they're pushing for, is dynamic assessment. So what is
Oh,
dynamic
good.
assessment, right? It's test, teach, retest. Now, of course, when I bring the self out, all my SLPs out there know the self.
Yep, we all do.
When you're scoring the self, we're sitting there, do they have the skill or do they not? Marking yes or no. But oftentimes, as speech pathologists, I feel like this comes innate. We kind of want to see if they can acquire that skill. So while, they may have it or not, I will oftentimes give an extra prompt, to kind of prompt a skill and see if they'll respond to that. And then, of course, write that, right? So that's more of a dynamic assessment. So it's, kind of that test, teach, retest realm, where we're being responsive to these children, right? I mean, testing, it's not static in nature. Most of us can't sit, a lot of us have a hard time testing as adults, right? It's hard to sit
Mhm.
and attend and know exactly what's being asked of you. But if you are on the child's level, wherever that is, if they're a preschooler, if they're a teenager, and then interacting with them naturally, because we're speech pathologists, that's what we do, right? You're kind of adding that component and you're able to see where they can go with that guidance, right? And
Yeah.
furthermore, um, it can really educate the student support team as to like what kind of mediated support they need in the classroom, where the speech therapist needs to go after they receive your assessment. So it's really about being dynamic in nature. So you're
Hmm.
using your clinical judgment and your intervention skills, I think, while you're assessing, right? They're not
Hmm. Hmm.
separates.
Yeah, and thinking about that example, um, what I would probably do is, to give the test, all the subtests, that I need to give. And then if I had time, and hopefully I would, to go back and maybe, pick a couple of the sections and the subtests and do that and just see what happens. Um, I know that sometimes, and I remember being told this in school, which was a long time ago, that, you cannot give any prompts, it has to be, clean, and you can't give prompts because that might um, skew the results of it or whatever. But I totally understand what you're saying. And, and it makes total sense to me. And I think, it'd be nice, and I don't know and I haven't read your book, but I need to get your book and do that. I'm wondering if there's some way to combine that and maybe have some subtests that are, strictly, just, based on yes and no and point and don't point kind of thing. And then other times where you bring out the assistance and it's more dynamic and based on really what the child can do and can't do and observing and what he needs and that kind of thing.
Of
I would think that combination, and maybe that's where you're going as a combination. I
Of
don't know.
course. And I feel like that's very effective. So I obviously conduct the self all the time. So for example, the syntax section. So we're talking about grammar. And there is always a model at first, right? So you're giving immediately that model because it's kind of hard. You're working on past tense progressive. You're probing for this. So like it is kind of embedded. But then furthermore, this is why it's kind of important to have the language sample, right? Because we're going to go back to the language sample. Is the child using it in their speech? Right. So
Right.
we're using that
Right.
standardized test score. Okay. Johnny has a really hard time with grammar and syntax and putting sentences together, full sentences together. But then you're seeing how he's carrying that over in, interactions with me or with his peers or with the teacher. So I feel like everything is incorporated. I think the parents really appreciate that. I've been told that parents like to read my reports and even the teachers do. And, for the student, because it shows that we are not just our test score. We're way beyond that, right? And our
Amen.
goal as speech
Yeah.
pathologists are not only to give our children a voice and to help them advance academically, but to show a full picture of a child, right? So I feel like,
Mm-hmm.
it behooves us to to kind of incorporate all of those
Mm-hmm.
sets.
Mm-hmm. Okay. All right. Good. That makes total sense. Now, is there anything else that, before we move off the zone of proximal development, is there anything else that you wanted to mention about that at all?
Um, so let me see. So there has been, I did want to incorporate, there has been some research references by other SLPs in the past regarding applying Vygotsky and developmental theory to language intervention. If anyone's interested, Poner had researched something back in 1995, and it explored how Vygotsky's concept of ZPD can inform language intervention strategies. This is like a very cool article. And it kind of gives a basis of the importance of identifying that and working within that. So for example, you're not going from a child who's nonverbal all of a sudden having a IFSP goal that they're going to say, 4-word utterances in a year, right? So the idea is you're scaffolding this. We're not starting here and jumping up to the top. We are, working along that continuum.
Sure. Yeah. It's called development.
That's it.
Yeah, yeah, pretty much. Yeah, yeah. We do have a comment, a really good comment. Do you have your chat out there?
Let me see. This question pertains to school-age children, but is related to good quality dynamic assessments. Have you found a good quality language screener that you feel has good validity? With our massive caseloads, I would like to not have to evaluate children who likely don't need evaluations and focus on going through dynamic assessment for those who really need them. You know, so I'm sure that you are familiar with the self has a screener, especially if you work in a school. Um, that screener I have found is quite hard. A lot of my children that are on caseload have a very hard time with that. But it can probe whether they will pass the standardized test. I don't know if that helps. So that way you can kind of identify, like, is this red flags, right? So we're talking about, it has an area on syntax. It has an area on like working memory. I think there's some areas that probe that. So to answer that, there haven't been great screeners. What I have done and why I kind of wrote this book was I wanted to know what was expected at certain ages. So I will reference, like, we're talking about Brown's morphemes. We're going way back to grad school, right? I will
Way back
reference
before
that.
that. Yeah.
I will
Yeah, they were
reference
around
that.
when I was there. Yeah.
I know. Especially in school age, I will reference Brown's
Sure.
morphemes. I'll also, what I do, which is important in the schools, is, and they require this, a full teacher interview, because it's important to see how they're functioning in the classroom, especially as far as
Yes.
qualifications go. So if the child, let's say they're a borderline score, but they're really not able to engage in classroom discussion, we can talk about like the impact, the academic implication. Oh, how do we spell the researcher's name? Okay, so the first one was Poehner. It's Poehner.
Oh.
Yes. There was another piece of research, if we're going to go on this, ladies and gentlemen, I'd be fine. It was on mediated action analysis. So this was a tool for planning zones of proximal development. So the idea is it's a method for identifying the child's ZPD using standardized test results. It provided a framework which could be aligned with interventions. I didn't exactly see anything from this article that provided a framework, which is kind of why I developed the protocol, because I wanted something that would calculate where a child is currently functioning. So I actually have a tool that will calculate which areas need intervention and probe that in every area. The
Mm.
second person is Hagstrom, and that was in 2000. I like you guys asking. Thanks. I wanted
You
to do
know,
my research for you.
there's another one above there on the chat. But
Oh,
cool.
okay.
I also probe underlying. Yeah. You want to read that one? Do you
All
have
right.
that one?
See. Underlying skills that the child made errors in by doing tasks that target those skills. So pronouns, prepositions, past tense, plurals. You guys are familiar with this. If they do not know it, I do a little instruction to see how quickly they can pick up the skill. Of course. So you're very much like me with this when we're talking about, the self, and we're talking about, I tell the students we're working on grammar and syntax. So these are just rules for when we're talking, right? In the English language. I'm going to put that in there. And I think that's important, because like I said, assessment should be interactive in nature, right? Especially if we want a child to feel comfortable with us and not like they're sweating while we're testing them. We never want kids to come and be worried to come to us, right? So you kind of want to instruct as much as you can. I love that. Thanks for sharing.
Yeah. Yeah. Did you get that one from Bakul? Did you read that one?
I did.
Oh, okay.
Yeah,
Okay.
those
All right.
underlying skills. Yeah. Teacher checkoff of skills that they need to be successful with language-based skills. I love that. Yes. And the
Okay.
self, I don't know if you guys are familiar, but the self does have a teacher questionnaire. The easiest thing that I do, so we're talking about kids, because I test kids preschool all the way up, is obviously I ask those like big red flags. How are they with following directions in the classroom? I look at the classroom size because that can have an impact. And of course, that probes receptive language. Then expressively, are they able to answer questions when you call on them or engage in class discussions? That's a big one for middle schoolers
Mm-hmm.
because that's like a common core competency for those of you that work in the middle school. So that's another area. But I love that, a teacher checkoff of skill.
Well, I think it's just important for almost every grade. And when I was in the schools, and I would go into a classroom and maybe I would just sort of stand there and, you know, see the teacher teaching and observe my class or my kids that are in that class and that kind of thing. And I learned a lot, as to what some teachers did and what some teachers didn't. And some teachers do not encourage, excuse me, do not encourage discussion, or maybe they'll ask a question and I'm certainly not criticizing teachers, and I know that a lot of times they have a great deal of information to get to and they want to just move right along as much as possible. So I think sometimes the discussion time, is not always done during, and I'm even just saying from second grade up.
Yeah.
I just think it's really important to have that. And, like a teacher might ask a question to the class, just class, here's a question. And
Mhm.
the same five kids will answer it, and then they'll move on, and then there's my kid in the back, of the room, or maybe off to the side on his own little desk, and he's drawing and not really paying attention. And it's
Yeah.
not really part of what's going on. And I think that's important to kind of know the teaching style of what's going on in the class. Or, I think sometimes your kids are kind of scared to even speak up because the teacher really values the quiet in the class. And I understand that too. But yeah, I think that discussion is so very important, and that interaction. And especially since we're kind of in this, technological age, where a lot is done in texting and emails and all the social media and so on. So at any rate, I got off onto that, but
No, that's
I
okay.
think the
You know,
teacher, I think that teacher piece is an important piece to investigate. You talked about kind of being a detective. I think that's important, and to really have that discussion with the teacher.
and it also adds to buy-in from the teachers. So,
Yes.
not to go on a tangent, but I've told you guys that I've worked in middle school. And so oftentimes I was told, actually, when I first started working in middle school from preschool, the students came to me and they said, Miss
Mm,
LoPresti, I don't want you to give us extra work. Why are you giving us extra work? Can't we work on what we have from class? So oftentimes I had a social studies teacher where I would say, what is coming ahead the next 2 weeks? What are you going to be teaching? I would love to prep set and prepare
yeah,
my students for it.
sure.
And so one day she was like, okay, so, it was our first run. She said, I'm going to ask the class about this reader that you're going over with the group, the eighth grade group. And so she's like, around this time, I'll be in the classroom speaking about it. And so my office was across the way. So I made sure to kind of like stand in the doorway. And would you know that the child who never participates because he was uncomfortable to do so was raising his hand and participating, and the class was like, great,
Yeah,
great points, great
yeah,
points. And
good,
and so
good.
he shared with
Oh,
me afterwards. So that's just saying, it's important to incorporate teacher input because they're burned out. Probably a lot of them are really tired and they want to know that we have their back, right? We're not just pulling these kids out disconnected from school and the
right,
schoolwork, right? So it's all
right.
integrated. So it helps. It helps with buy-in for speech therapy, I think. So
Yeah,
so for
I
the
think so
tangent,
too.
guys. Yeah.
I think so too. I think it's very important. Now, I know that you have also mentioned about um, maybe some specific techniques and examples of, coming up with insights about pragmatics. I mean, the expressive language is, I don't want to say it's easy, but it's there. It's kind of tangible, in
First.
an auditory kind of way. Um, but the pragmatics is tougher, I think, but maybe not. I mean, what do you have for us in regards to
So, I mean,
analyzing?
I love that. So that is where you get a student in, and you're observing them in the classroom with a peer, right? Or their interaction with a peer.
Okay.
So
Yes.
I
Okay.
know that a lot of my SLPs out there have done standardized pragmatic assessments, which are very long. The couple of the ones that I have conducted, they take a very long time to conduct. I think one of them, I can't remember the name, it took me at least an hour to have the picture prompts and to ask the child questions about inferring, inferring different
I
things.
remember doing some of those. Yeah.
Yeah. So it was so hard. And I feel like it's so some students that are smart enough are able to understand what they're supposed to say. But when it comes to using that skill, right? So asking a follow-up question, or guiding the conversation towards a speaker other than themselves, they can't do that in practice, right? I like to tell people when we're talking about pragmatics, it's speech in practice, right? So it's interactive, right? We're not just walking around talking to ourselves. um so it's
Yeah.
right, these kids look good um, on paper, but stand out immediately in a group. Absolutely. And so that's where the
Yeah.
importance of these
Yeah.
checklists come in. Or
Yeah.
from the parents, because, also I've had feedback from parents where a child really is struggling at home because it's not as structured as a setting. So they'll try to take the child to the playground and they're like, this is a disaster. I won't take my child to the playground because they're running up and pushing, peers, and they'll present differently than how they are in the classroom. So that's where, that feedback is so important, and that's where it's kind of like a checklist. Do they understand the nuances? Are they engaging in a dialogue with you? Or I have some kids that only want to engage in a dialogue with adults because they feel more comfortable doing so. Or are they able
Hmm.
to engage in that back and forth with a peer and build those meaningful connections, right? Because
Hmm.
that's
Hmm.
how we connect with others through, language or nonverbal language too. That's another thing that we probe.
Ooh,
No,
yeah.
and it's hard to put that on its own.
Yeah.
Yeah,
There's a whole another form of communication, isn't it? And
true.
that one, yeah. I mean, I'm just not sure that my language disordered kids ever totally realized how they looked when they
Yes.
were, acting out or, saying things that perhaps were not very nice to kids.
Yeah,
I mean, and sometimes I noticed and I would, see some of these interactions and maybe it wasn't so much what the child was saying, but how he was saying it or she was saying it. And I
exactly.
mean, it's just,
Tone, the
yeah,
tone.
yeah, it's
Wait a
crazy.
minute.
Totally. I mean, it's just, yeah, this whole area is just huge. But yeah, what do you have any examples of kids maybe that you've worked with and, of your assessment and that kind of thing that perhaps you could give us some examples of what you've
So
done?
I work in the preschool part-time in the Bronx, and I have a number of children who are, they perform well on the tests, but pragmatically have deficits, right? So I had one child who came on in to my classroom and he's like, Miss LoPresti, get me that. And I said, wait a minute here,
Yeah.
a minute, well, let's talk about this.
Mhm.
First of all,
Yeah.
it doesn't make me feel good when you speak to me that way. Meanwhile, the child's 5, right? So, like, let's say you hurt my feelings, but what is that? So
But
let's talk
no,
about
that's
this, so, when you talk to me, you kind of talk to me in a different way than you talk to your friends in class, right? And so that's when we're discussing about learning about, who the audience is, reading the audience. He said, okay, I'm sorry. Can you help me with this? And I said, well, this is nice. I feel better when you do this. Um, and then a lot of so of course working in preschool we do a lot of interactive play and gameplay, so basic gameplay, so we're talking about turn taking. And despite some children being exposed to peers, so I have a couple of kids that are twins, they cannot share. They have a really hard time sharing. So it's a lot of pause, let's wait, whose turn is it? So you're kind of, building on that interaction. And then if the child is like cognitively able to discuss, like, okay, why would what you said be hurtful to me or seem a little rude, right? Or, hurt my heart. So it can be like explicit training in those areas, or just practice, right? Because I know a lot of us will do that turn taking engagement with children that are, we're talking higher on the spectrum, right? So they're verbal. Uh,
right. Yeah.
and if we're talking about children that are nonverbal, I mean, what are we working on? We're working on that joint attention. um like, are they able to like demonstrate what they want? Are they able to like have a purposeful point? Are they able to functionally communicate? So this is why they call it a whole range, right? It's a spectrum, and so that's
Yes.
where, as speech pathologists, we're guided to, scaffold our treatment and intervention. um and that's what kind of makes our job fun, right? It's dynamic. We're not just sitting there and across the way from a bot. It's not the
Right.
same
Right.
thing.
Yeah.
So
Yeah.
right?
Yeah.
Not
Well,
you.
Yeah, there's going to be strengths, there's going to be weaknesses, and we have to know so much and identify those things in those specific areas, and then how do we move them to the next level, and I guess where are they in that proximal zone of development? So, yeah, tell me more about your assessment and some of the information that you have in your book that you can share with us about how do we do this?
Of course. So, the whole idea came from, so if I have any speech therapists out there that work in early intervention or children that are nonverbal or can't sit for the PLS, I hope I have some of
Right.
you guys out there.
I'm
This
sure.
is the majority of the children that I've been testing, or even coming in early intervention. So in New York City, um, oftentimes the child comes in with an evaluation. It's not always highly comprehensive. You don't know what you're walking into when you're walking in the door. The first question I get from parents is, um, what should my child be doing at their age? Right. And I got this a lot. So much so that, I mean, we're the experts. We're coming in here. I would say, you know what? I'm going to go home and email you a checklist of exactly what we're looking for. Now, I'm not breaking it down so advanced. I'm kind of giving them something that's a little higher than what their child's doing, right? So let's say the child is 2 years old. They're not saying one word utterances. They're not even labeling. So I will say a child should be labeling items, right? So this idea came through. Oftentimes, what I would do is I would grab out the Westby play scales. I'm sure my other SLPs are familiar with this, or the Rossetti.
Mhm.
And what does this do? It's a checklist, right? So the child either has the skill or not, but it's hard to track how they're progressing through the Rossetti. How are they progressing throughout therapy? So every time I had a quarterly report due, I would have to pull back out the Rossetti and say, all right, they have this now, scattered skills in this. And then I'd have to kind of calculate in my mind, all right, what's our next step? What's our, if I have to adjust my goals, what is our next step? So basically, the idea of the protocol came in. So I researched developmental milestones in as many areas as I could find. So we have pragmatics, we have Browns. I even have Browns in there. I have swallowing and feeding because a number of years ago, I was kind of thrown into early intervention cases with swallowing and feeding with babies, complex babies. And I thought, okay, this is interesting. I had a textbook that I bought for myself because I was like, this isn't my realm yet. So I have basically developmental milestones of swallowing and feeding. So for example, one step is like, can a child hold themselves up unassisted? You don't even think about that, right? Like usually you're like, what? Like the parent's just feeding the baby, but like core support, things like that.
Sure.
So I have all of these different areas that are in different chapters of the protocol with examples of how it's been used. And then I have a calculator, which you can go in, click off the skills that the child has, click off if they either have it or not, if they don't have the skills. And I have a calculator that will calculate areas needing intervention. So it calculates really areas that we're intervening in. So the idea is that you're constantly able to calculate what you're working on. Because sometimes you go into therapy and the child has a skill all of a sudden. For example, like a problem solving skill. I had a child in the preschool who loved plastic bags. And so we had to hide them, right? Because it's not,
Yeah.
not safe.
Yeah.
So one day I was always hiding them in different spots. The good thing was she has object permanence, you guys. I found this out because I put it up on the top of the counter, right? But the counter, she was a short little thing, 4 years old. She was short, couldn't reach the counter. So I bring her into my therapy room. She goes to one of my chairs, pulls the chair up to the counter, climbs on the chair and grabs the plastic bag. So it's like basic problem solving skill, right? Problem solution, right? Which I didn't realize. But that is, that like responsiveness is like a milestone. It's a cognitive milestone, and you can kind of track that. So I'm like, wow, she knows this. She knows this skill. And it
Yeah.
also helps with like parent input, because oftentimes if parents don't hear their child speaking, they don't think they've progressed in speech, right? And there's so many different areas that we can progress in. Some children have like learned to follow multi-step directions that are routine. So it's kind of a way I've used it. I developed it for myself to make my life easier, right? But I've
Yeah.
used it to kind of help guide not only my own practice, but, demonstrate, you know, their their progress, in all these different areas. Let's see. Oh, I love this. It's so important, especially for very low functioning kids who consistently score below the first percentile. Yes, on standardized tests. Dynamic assessment is really the best way to show progress. I totally agree with you on that one, for sure. And it feels for us as clinicians, I think it makes us feel better to know that we're still doing something right, even though people say, well, John isn't talking yet, right? Um, it helps us internally too, because, we're the providers. We want to see, progress as well. We're invested.
Right. Right.
Yeah.
Yeah. No, it's multifaceted. I mean, hugely multifaceted, from cognition to behavior to just formulating intent, having the skills to motorically produce all of that, the appropriateness of it. I mean, it's huge. It's just huge. Now, as far as the dynamic assessment that you do, I still don't have a clear picture as to what you're doing. Now, do you, like with the young children, do you walk around the room and set them up for situations and see what they do and see if they say things? Get them out of the chair or, off the floor and up and moving. Do you know what I'm saying?
Of
How
course.
far do you take your dynamic assessment?
So, and this is even so I had shared with you guys that I work in New York City Department Public Schools just doing assessments. I will always bring my bag of tricks. So other SLPs know this, right? I will oftentimes I'll bring bubbles because I don't know how the child is functioning. That's very cause and effect, right? And I'll see if I can get functional requests out of them. And oftentimes, if the child is in the assessment room and they're wandering around, which I see a lot of the time, I will do more of a floor time model. So, what is that? That's child-led assessment, I would like to say. So, I'm down there, I'm following them around. So, for example, I had a child who brought him into the assessment room. I have my PLS up on my computer because we have it on computer scored now. Didn't even look, right? I think a lot of us get this. Wasn't even interested. He had the aid, no, zero interest. But there was a rug in the room that had the alphabet and colors and letters, and then some pictures.
Yeah.
So he started jumping on the letters of the alphabet. So, jumped on A, B, and then I was like, okay, A, B, C, and then we were singing the alphabet together, right? And so I was like, so then the next time he went around, I said, red A, and then he was able to identify, blue B.
There you go.
What am I doing here? I'm like probing his skills. Now, obviously, for those of us that know the PLS, this is a skill, right? They have to know colors. They have to, this child had great phonemic awareness, obviously. It was better than anything else. But this idea of being dynamic, it's really getting down on the child's level and seeing how they're functioning, right? So following their lead, we're going to get a heck of a lot more out of them than us directing them,
Yep.
especially nowadays, right? So if we're telling them what to do and a child can't even sit, you're going to have to stand with them, right? Like, and that's okay. That's totally okay. And I
Yeah.
feel again like it really guides not only assessment because you can see how far off they are from the norm, right? Because I think at 5 years they should be sitting for at least 5 minutes at least and attending. So if the child is
At
jumping
least.
up
Yeah.
jumping up every 10 seconds, you're like, okay, so this is obviously, a deficit. Let's see, let's follow their lead. So to answer that question, I always have a bag of tricks. I usually have like a puzzle. I always have either a number or letter puzzle because my kids really like that, especially the nonverbal ones. I also have animals, like little mini animals that I bring in. And again, for those of you that do EI, I'm sure you're familiar with the big bag syndrome. You know, you have a zippered bag, so the child has to request what's in there. So I'll take something out discreetly, but I'll also close the bag in front of them and see if they'll try to see if there's more items in my bag, right? And that's a functional request. So really,
Certainly.
it's kind of incorporating that floor time model with assessments. Now, even with let's talk about middle schoolers. I've had some schoolers that I've assessed, and they've had a really hard time, oftentimes in literacy and reading. So if it's difficult for them, have a really hard time, I will stop and do like talk alouds. So let's say it's a story, and I'm trying to guide whether they have comprehension. I'll kind of say, well, have you ever had a situation where this had happened with a friend? And again, that's kind of, I feel like it's more student led because they're more engaged with me, right?
Mhm.
So that's where it's dynamic in nature, right? So we're kind of, I'm seeing how much I can give and how much I can get back. And you know, it's a constantly moving, you know, we're kind of moving so that we're just above where they're functioning, right? Or just seeing their strengths or weaknesses. Um, I don't know if that answers. So,
Yeah, no, and you were talking about older kids, right?
yes.
Yeah, yeah, yeah.
But
There,
I mean, like I said, it's interesting. I mean, we wouldn't call it a floor time model with older kids, right? However, it's really important to kind of sit down and listen to them and like, you know, let them lead sometimes, right?
oh, definitely,
100%.
definitely.
Yeah.
Yeah, no, I mean, and that's when you get the good stuff. And that,
Exactly.
yeah, and especially when it's about them or an experience, something firsthand. I mean, that makes total sense to me.
Yeah.
Or a friend, or something that happened, with they went shopping or something. I mean, yeah, I mean, that makes
Or if
total
it's a
sense.
boy, if it's a young boy, what do? I get out like an easy reader, a leveled reader with sports. So I'm like, so what sports
Perfect.
do you like? Yeah.
Yeah,
They can go on and on about that, right? And then if
yeah,
I'm asking questions and they're not responding to my questions, I'm like, okay, this is interesting, right? Like I'm going to kind of make note of that, right? So I want to be part of the discussion. Are they engaging in a discussion with me about it? Or are they just
yeah,
going on and on?
yeah, yeah, yeah.
But you know,
No,
I use this, it's interesting because this is based on peds, but I've used this with adults as well, right? I do think, and this
with
probably,
adults.
well, yeah,
Wow.
like my psychology backgrounds. I think
Okay.
developing rapport, which is with children, floor time with adults, it's kind of asking them about themselves, bringing in a newspaper. It really helps with like effectiveness of like assessment and then guiding intervention.
Oh, yeah. Yeah.
So, you know, I'm like all about that, you
You're
know.
talking more brain injured, whatever,
Yes.
stroke cases, head injury.
Yes.
Yeah.
Or just like dementia,
Yeah.
right? So like, are they oriented? You're not going to go on in like the doctor comes on in and says, what's the day, date, and time? You
Yeah.
know,
Who's the
you
president?
can't,
Yeah. Been through
you
that one.
can, or you can bring in whatever if they like the post of their New York Times and say, hey, did you see, you know, what, and then see if they pick up on those cues too. Like,
Yeah.
were
Yeah.
they able to read
Yeah. Yeah.
what
Or
day it is?
what their profession was. Yeah. Yeah.
Exactly.
Yes. Yeah.
It's
No,
different, but
it's,
it's not so different, right? Because we're talking
hmm,
about, you know, we're talking about people here. So,
yes.
you know, yeah.
Yeah. Yeah. Totally. Totally. And I think especially when you're in the schools, you have to have a mix of, the normed, plus dynamic. And, I think sometimes, in my life and, as a school therapist, you've got, I mean, in any environment, I'm sure you've got a lot on your plate. And sometimes that
Caseload.
dynamic piece sort of goes by the wayside. Or maybe it's something that I do during therapy. And, I do the normed stuff, to get them in therapy. And then,
Yes.
hopefully for some kids, and the dynamic in therapy. And is that something that you do or recommend?
100.
Um,
Yeah.
yeah, in the therapeutic process.
Yes. So, and that's kind of why, like I said, I had developed the protocol because it's not meant to just identify a deficit, right? It's meant to be like a moving, kind of like moving, what would you call it? Like benchmarks, right? So
Mm-hmm.
by clicking off they have this, it's kind of easier to track, okay, this is where we're going next. Or I've used it with articulation, for example. We have a child that has profound phonological, deficits. You're not going to, just go to the hardest one. You're not going to work on the R's right away, right? If they can't do the K or the G. So it's kind of showing, like the sequence of things. And of course, being dynamic, you're right. As a good clinician, we're always kind of assessing how our children are doing on a day to day because they can make progress, even if it's small.
Yeah.
We're the only ones seeing it, right? They
Yes.
got that past progressive, you're like, great job. And they use it in their writing. So,
Yeah. And I'm always amazed. Yeah. But and then you want to document that. Yeah,
yeah.
definitely. Yeah.
And you're
Uh,
hoping that somebody's reading it besides you or the next SLP.
yeah. Yeah, definitely. Yeah. And I think that's where communication with the parent and the teacher comes in. Yeah, here's what happened today.
I
Check that out at home or in the class. Yeah,
exactly.
that's important.
Exactly. And
Yeah.
again, like I said, it kind of pitches what we do, right? We're not just pulling kids out. If we're talking about language acquisition, which I love, like functional communication, parents will be like, you did so much. And I'm like, I'm teaching you. I'm here for only an hour and a half each week. You're here for the rest of the time. So you're doing the work, right? So again, it adds in, that added joy that they're really helping, right? And that buy-in for what we do as speech therapists, right? So it's
Yeah. Ooh, there's an important topic too, is working with the parent.
yes.
And that's always difficult. I mean, it's difficult as far as, if you're in the schools, not so difficult if you're going to their house or even in a clinical setting. But any suggestions if you're in the schools, how to incorporate, specifics that parents can do?
So, this is one good thing about technology. We do use Class Dojo. So I am able to either send a message to all the parents. So I'll send like a handout. I really like the Hannon Center. I don't know if anyone's familiar with them here. They're based out of Canada.
Hmm.
They have great handouts for children if we're talking about like on the spectrum, right? So it's about pitch and return, right? So that conversation and follow a child's lead. So I will often do that. If we're talking about older kids, I will send the parents, I'll ask them, do you want me to send you an email as to what we're doing or what Johnny did in class today? And then, of course, when we have parent teacher conferences, that's when they come in. Um, and that also works with early intervention. Now, early intervention, it is difficult because if I have any SLPs here, you're the one who, see, I love that it takes two to talk. You're the one that's kind of demonstrating to the parent that there's a deficit, right? So you're kind of, I feel like some pediatricians, we're kind of the bearer of bad news, right? John isn't talking yet. He's supposed to be talking. So it's just coming at that with like grace and understanding, right? We're only there for 30 minutes. These parents are there the rest of the time, right? And so like the way that we can effectively help them is to give them the tools that we have as much as we can so that they can make their communication, easier with the child. They can help with transitions. So to answer your question, I will send parents notes, and I will send them even video clips of a child who's talking. I'm like, John said this today. What's he doing at home? And they'll send it back to me,
Mm,
what's going on at home. So
love
I
that.
love that. And that's across ages. Middle schoolers don't want you to talk to their parents.
Yeah,
So you keep that under
got it.
wraps.
Yeah, yeah.
So I mean,
Oh, I love
that's
that. The videos. I mean, obviously you have to get permission and all of that stuff, but you take the video and then send that
I send
electronically,
that to the
obviously.
parents electronically. So I
Yeah.
have a couple of kids where the parents, I have all the parents like personal and it goes to their phone.
Yeah.
So I'll
Yeah.
say, hey, John said something, today, or, I'm thinking, can I send you something? And they'll They absolutely love that. It's the same way with like feeding because we do have a feeding program in our preschool. So we have some children who generally don't eat anything at home. And so the teacher will
Mm,
see that they're eating something at school. So they will send the video to the parent, like, look,
yeah.
they're eating something,
Yippee. Yeah,
I know it's huge. And I
it
think
is.
that's a
Totally.
whole nother can of worms,
Yeah.
because parents
Yes.
are, it's upsetting. I think it's probably triggering. Like if your child isn't eating, right? You feel like you're not doing what you can be doing,
Yeah,
like
that is huge. Totally. Yeah. Yeah,
so,
definitely.
but that's a time for, that's a discussion for another time. Let's
Yeah.
see. I
Now,
love that. She said it takes two to talk, very parent friendly. I loved that. So I
yeah.
lucked out. They had not to totally overtake this, but they had come to our graduate school to talk with us, the Hannon Center. And
Oh, nice.
yes, this is when I was first introduced to it. And
Yeah.
I just absolutely loved like the parent training because I feel like I definitely use that in early intervention and like I was telling you guys in the preschools that I work in now, because the preschoolers I'm seeing are more kind of in the early intervention stage as far as how their development is going. So it's great to just kind of send that information and they're able to see success if they use, those some of those strategies.
Love it. Love
Yes,
it.
I know.
Now, if you're doing, if you're doing therapy in the home or in a clinical setting and the parent is nearby, hopefully, do they ever sit in? Or are you for that type of engagement or
So
not? Would you
it did,
rather
you know what?
not?
I mean, like,
Which is best?
so here's the thing. When I was in graduate school, I always remember thinking in the back of my mind, and maybe this was from a clinical supervisor. I always need to know why I'm doing what I'm doing. So I need to be able to explain it. I think that that's important because when parents come in and it looks like you're just playing or whatever you're engaging in, you can kind of describe to them, this is why I'm doing this, right? Like this is a manned model. What is a manned model? It's when I'm kind of putting the toys in the cabinet and they have to functionally request for me to open it to get what they want and then points. So I always tell parents if they come in, if they're in the school for any reason, come on in and sit in. Now, some parents will watch because the kids won't want to engage because they're there, right? And so
Yeah.
that's when you kind of talk to the parent. And again, parent coaching, right? Like
Yeah.
it's in a different setting. John knows he has to come in and sit with me, after washing his hands for speech, like these are some things you can do at home to help. You notice I'm doing this. I also will have personal aides come in. They do come in with some of the children, and I will kind of educate them while I'm doing the
Yeah.
intervention.
That's good.
That has led to better carryover. So I
Yeah.
love that too. So
Yeah,
it's
totally, totally.
yeah.
Did you read this one from Jen? I propped my phone up for a few minutes so the parents can see what we're doing and how their kids respond and how I guide the child. Now, so are you, Jen, I'm wondering, is this like for FaceTime or something, or how are you doing that? Is that like a live shot? I'm assuming. Do you see what I'm talking
I
about
do.
there?
Video on phone
Yeah.
texted. Okay.
Okay. Okay. Yeah.
And also, what helped? So during COVID,
Oh,
believe
okay.
it or not, I conducted early intervention virtually. Now, some children, as you guys could expect, it worked with, and some it didn't. And the ones whose parents were engaged, it worked very well, right? So the
Yeah.
parents are really, they're there and they're seeing what's going on. You know what else too? When I was in early intervention, I had a parent who would video record like live. So she'd go in the other room when I was working with her twins. So I know she was seeing what was going on because like there was definite carryover there. And like I said, I mean, we're clinicians. We know what we're doing, why we're doing it. We know the methodology in the back of our head, and it only helps. It only helps, our cause of what we're doing.
Yeah.
So
Well,
we're,
great. Great,
yeah,
great, great. I love that. Okay. All
we're
right. Let's see.
overtime.
Yeah,
I'm
we
sorry.
are. That's so good. Yeah. See, not sure I can talk, but my FaceTime. I record a video of the child and send it to the parents. Okay, good to know. Thank you, Jen. Thank you. Thank you. Great. Well, I think our time is just about up here. I am thrilled with all of your knowledge and all the good, insightful, and helpful things that you shared with us, and all of you that popped on the chat and the Q&A and your involvement. And I just appreciate you all so much. So thank you so much. I do have some other things here. In closing, I just want to thank you for being here and for tuning in, and also for getting the word out about the speech link. Also, I got notified this week that from feedspot.com that SpeechLink is number 12 in the top 45 speech podcasts on FeedSpot. So that's kind of fun. So
Congratulations.
yeah. So I want to thank them, and also you, all of you that tune in, for that honor. I appreciate it. Oh, and also, I found out that you'll be able to watch it in a few days on YouTube, so that's good. And also, if you desire, if you just want to access the audio only version, you can listen on most popular podcast apps that are out there. So, and I just appreciate you so much, and thank you so much for all your support and your positive comments and your good reviews. And Stephanie, I want to thank you again for your
You.
just so informative, and just so glad that you're in our field and that you put all this in your book. I really am going to get your book and learn from you, because it sounds like some really practical, really good information. So,
Thank you so much.
and yeah, and to all of you, I hope that you realize just how very appreciated you are. Thank you for all that you do, and for everything that you do for your therapy clients and the parents and the teachers. So I just wish you a good evening, and we'll see you soon. Bye-bye.
Bye.